Smoky skies over Chicagoland and much of the eastern part of the nation as we take a live look outside, and you can see the haze. Canadian wildfires are to blame and creating a real health concern for many.
Dr. Ravi Callahan with the Northwestern Medicine Group joining us now with more on the effects the smoke can have on our bodies. Thank you for being here.
Thanks for having me.
So we've all seen it. How concerned should we be, even though we're farther away than obviously New York City?
Well, I think the good news is we're a little bit better off in the Midwest and Chicago than New York has been in terms of the levels of particulate matter in the air. Although, last week we had high levels in Chicago as well. And the longer this goes on and the more frequently we're exposed to higher levels of particulate matter due to wildfires, the more health risks there are for the community in general.
Doctor, we've heard of people complaining, at least on the East Coast, of headaches and sore throats, and of course their eyes having difficulties after being in the smoke. What sorts of things need you to be wary of, and what can you do if you find yourself in that scenario? How dangerous can it be?
Yeah, so the biggest group that should be worried are people with chronic lung diseases like asthma or COPD, as well as pulmonary fibrosis, and then people who also have chronic heart conditions, folks who are elderly, and then kids who are quite young, because they are at the greatest risk for consequences of inhaling these particles and having complications of their illness or new illnesses. How concerned a generally healthy person should be? Well, perhaps a little less concerned than individuals with chronic medical conditions, but still they can have symptoms like you alluded to, watery eyes, sore throat, and these particles do get inhaled deep into the lung and can cause an inflammatory reaction in the lung. So folks who are exposed on these air quality alert days probably should not exercise outside if they should avoid it, probably should limit their outdoor activities. There are things we have to do, go to and from work and things like that, but probably limit the extra stuff that we want to do outside, unfortunately, on a summer day.
You know what I want to know, and I'm guessing other people, you're saying particulate matter. What's in it?
Yeah, so this is, you burn wood and there's soot. That soot can take a variety of sizes, and what's left over from burning wood after it combusts is cellulose, which gets burned into small particles. So these things are like 1/20th to 1/50th the size of a hair. They're really, really tiny, and they can get inhaled deep into the lungs and then actually even get into the bloodstream and cause injury sort of across various organs in the body.
Thanks for explaining that.
Yeah, exactly. Dr. Ravi Callahan from Northwestern, we appreciate your time. Thanks so much.
My pleasure. Thank you.
Okay,
Thank you.
Take care. Well.